Hello and welcome to Fast Forward Newsline. My name is David Kattenberg. With us again this week is Sarah Aronson.
Hi, Dave.
Hi, Sarah. Sarah, let's talk about prescription drugs and the price that people pay for their drugs, particularly those who are suffering from chronic illnesses. My old friend Rob Kendrick, who was the subject of a Fast Forward story, with Parkinson's disease, pays the drug that he takes, duodopa, $70,000 a year. I'm not sure how much of this he pays for out of pocket, probably a lot less than $70,000. But just this notion that a drug that somebody has to take in order to survive costs $70,000 a year. This seems like a very large number. Tell me what you've learned about the cost of drugs for chronic disorders of this sort, Parkinson's.
Okay, well, I actually looked at neurological conditions, and I looked at sort of degenerative neurological conditions, and it does sound like duodopa is very expensive. I had a look at, for example, Alzheimer's and other dementias, which are very common amongst people of retirement age, and also multiple sclerosis, which is basically has in people's late 50s, the rate of multiple sclerosis is the highest. So it is a disease of, well, not necessarily just older people, but it also affects people in retirement.
It's referred to as a disorder of young adults, but of course it's chronic. People live with it for the rest of their life.
Exactly, yeah. And if you look at something like MS, there are some medications that do help with the progression of the disease, as opposed to drugs that just treat specific symptoms. And there's about, I believe, 11 of them listed on the MS Society page. And their cost ranges from $20,000 to $40,000. But again, most of those drugs, we haven't gotten into this yet, but a lot of these drugs are covered under drug plans, whether it's provincial drug plans or private drug plans. And when it comes to Alzheimer's disease, the drugs are actually a lot less expensive. They're about $5 a day, so maybe $1,800 a year. And again, most of those are covered under provincial drug plans. So you may have drugs that cost a certain amount, but when you actually look at the out-of-pocket expenses that people are paying, if you look at some studies that were done, they showed for this one study, for example, that was done in 2014 called Mapping Connections. It was a study of the Government of Canada and the Neurological Health Charities Canada. And they showed that people with all three of these conditions, Parkinson's, Alzheimer's, and MS, pay about $1,000 a year out of pocket.
And provincial governments and federal government pay the rest in certain proportion.
Well, actually, that's interesting you mentioned that, Dave, because in fact, a lot of the money that's coming into to pay for drugs in this country is coming from private drug plans. So federal government actually only pays about 2% of drug costs. It covers First Nations and other sort of special populations. The provincial drug plans cover about 36% of the drugs in Canada, and another 36% are covered by the private drug plans, whereas the remaining, well, I don't know if the numbers exactly add up, but 22% is covered by out-of-pocket expenses. So we're talking basically the private drug plans and the provincial drug plans cover the same amount.
But what do you make of this idea that drugs of the sort that Rob Kendrick takes, duodopa, $70,000 a year, that the price of these drugs is really inflated? And we've heard stories of certain specialty drugs that have suddenly come to be owned by a given individual or private corporation, and suddenly the price rockets by 1,000%. And these are vital drugs. Is there a sense that specialty drugs for chronic illnesses are just overpriced? They're too expensive?
Well, I think they are actually very expensive, and I think it's because of patents, and it's because of international economic markets, right? National governments don't have as much control over the price of these particular medications, and even when you're looking at, for example, people who've been thinking about the idea of making a national pharmacare program in Canada, they have brought in their models, they've taken some classes of medications that they don't think they could reduce the prices on. Like, there's no way they could make these generic, there's no way they could make the drug companies charge less, because these drugs are just expensive and that's what they cost.
Tell me about ideas for a national pharmacare program.
Okay, well, a national pharmacare program is actually something that's been advocated for in the last few years, especially, and it's in some of the party platforms. I believe the NDP for sure. And basically right now what we have is we have a combination of provincial drug plans, and they vary from province to province. And we have private drug plans, like I was saying, accounting for just as much in terms of expenditure. And we have a little bit of a federal plan that covers First Nations people. But we don't have like a unified national plan. And some people are saying we should be having a national plan, and that would make things better. It would make things more even across the country, and it would reduce the expenses of drugs. So in the Canadian Medical Association Journal, for example, in 2015, I think it was March 2015, there was a study done by some academics, and they did a model, and they showed that if you were to leverage, for example, bulk buying, replacing brand name drugs with generics and so on, and reduce selection, because you do that when you have a formulary, like a provincial formulary, you reduce the selection of drugs. By doing that, they estimated that the total cost of prescription drugs in Canada could go down by about 32%. But you have to keep in mind that will radically change the landscape of pharmaceutical, not just in terms of affordability, but selection. And you have to consider, like, what are the affordability problems right now, for example. You have to look at who's covered, who's not covered. And so there have been some skeptics of pharmacare who say, well, right now, if you look at, in terms of people's drug coverage, 24 million Canadians are already covered under private drug plans. And so it's a plan that it's yourself or your spouse or dependents. And there are 11 million Canadians that are eligible for coverage under public plans, which are basically provincial plans. And there's only 100,000 Canadians, according to this research, which was done by the Canadian Health Policy Institute, which is a private think tank. According to them, there's only 100,000 Canadians that are not covered for everyday drug expenses, and everybody across the country is covered for catastrophic expenses. So they're saying, well, if you were to create a national pharmacare plan and you create a formulary for the whole country, people who are now covered under these private plans where they have access to more medications, and maybe studies have also shown that the newer drugs get approved faster, quite a bit faster, on these private plans, they're going to be forced onto a different standard of care.
How about these 100,000 folks who don't have any coverage for their drugs? Who are they? Where are they? And are they being forced to pay out of pocket these huge sums of money for diseases that are chronic, I can't imagine having to pay out of pocket $70,000 a year for a drug.
Yeah, I wish I knew. I'm afraid I don't know who those 100,000 people are, but I do know.
It's a terrifying thought to think of somebody who's essentially indigent and comes down with Parkinson's disease, and how are they going to afford to pay $70,000 a year, or even $10,000 or $15,000 a year to treat something which they have no coverage for?
Well, exactly, and it would be nice to look and say, well, is there a gap in provincial coverage right now? Is there a gap in territorial? Like, what's the situation in the territories, for example? I don't really know, but what I do know is when it comes to affordability issues in Canada, 1 in 10 Canadians, some studies have shown, and another study has shown, basically 10% of prescriptions are not filled because people can't afford to pay for them. And compared to other countries that do have like a national pharmacare strategy, like say the United Kingdom, these numbers are a lot higher. Like in the UK, it's 1 in 50 British citizens who can't afford to pay for a prescription. So there is an argument to be made that coverage does need to be improved. I think the question is just like, what's the mechanism? Is it going to be something that gets improved at a provincial level? And if the provincial level already is maybe not covering some of the newer medications that people find helpful, maybe the provincial coverage needs to improve. And when it comes to in terms of saving money, I don't think right now we're spending way more money than a lot of countries. If we reduced our expenses by 32%, like the people who published the study in the Canadian Medical Association Journal say, we're going to end up with, basically we'll still be spending more money than a lot of countries. We'll still be spending more money, I believe, than the Nordic countries, than the UK. So we're not talking about making our expenses go way, way down anyways.
Sarah, thank you so much for coming in again and speaking with us about this.
You're welcome, Dave.
Sarah Aronson is a local Winnipeg-based radio broadcaster and writer. You've been watching Fast Forward Newsline here on the Green Planet Monitor. We come your way each week in this same little box. Fast Forward is generously supported by the Government of Canada, the Social Justice Fund of Unifor, and the Campus Community Radio Fund, and the Community Radio Fund of Canada, I should say. Join us again next week at this time. My name's Dave Kattenberg. Bye for now.